What is Botox?
Botox is a medication that's commonly used to relax overactive muscles, which is how we basically get rid of lines and wrinkles, which are the result of these muscles.
And how does it work?
Good question. The impulse from the nerve to the muscle is blocked by Botox. This causes the muscle to relax since it can't respond to the nerve impulse, and that's the way it works to help relax those overactive muscles and get rid of the lines and wrinkles that we're trying to avoid.
Okay, so typically how long does Botox last and how often do I need to get it retouched up?
Another good question. It lasts, if it's used full strength, for at least 3 to 4 months. We've seen it last longer, not uncommonly, but we like to tell people that 3 to 4 months is a good gauge. And generally speaking, if you get enough product in the desired area, it should last at least that long. We tend to recommend that people come in before the muscles return back to their full state, so you maintain the results for a longer period of time.
So at Avalon Laser, what areas do you treat with Botox?
Avalon Laser is pretty expert at treating clients with Botox for all the common areas. The most common areas where people get Botox are in the forehead, in the glabella, also known as the 11s, and in the crow's feet area. Now, we are pretty expert at using more advanced techniques such as around the lips and the mouth as well, and there are other areas such as in the underarms where we treat excessive sweating, which we also call hyperhidrosis, and Botox in that area tends to last even longer. When clients come to us, they discuss what concerns they have, and we put forth a plan of action for them.
So does Botox hurt? Is it a painful treatment?
Not at all. When we use very, very cold ice, we find that clients oftentimes say the ice was more uncomfortable than the Botox injection. It also helps reduce bruising, which is a very nice side benefit.
So what can I expect with recovery time after the treatment?
Generally speaking, people have even gone back to work the same day. We find that Botox, when applied properly, is almost inconspicuous. And so once you've been injected, it's not uncommon for people not to even be able to notice that you've had it done.
After getting Botox done, when can I resume normal physical activity?
That's a great question. Generally speaking, we like for you to have at least 24 hours away from any heat, exercise, activities involving heat, such as jacuzzis, saunas, etc. This helps prevent the Botox from spreading abnormally and the potential complications from occurring. After 24 hours, you can resume your normal activities as you normally would.
Okay, so when will I see results?
Great question. Typically, and this depends from person to person, we tell people about 1 to 2 weeks is a pretty standard time to wait until you see the maximum effect of Botox. After that time is when you're going to see the effects that'll last for the full course.
Is there anything I should know beforehand to prepare for the treatment?
It's a great idea to avoid medications that can thin your blood, and these can increase the risk of bleeding and bruising. And so we tend to recommend that people avoid medications containing aspirin or ibuprofen or other NSAID type products. If you are on blood thinners and you want Botox, you will want to consult with your physician beforehand. We have treated people who have been on chronic aspirin use, although we generally recommend that people avoid these products beforehand.
How do you recommend I choose a medical spa Botox provider?
That's a great question. You want a medical spa that has a lot of experience treating Botox clients and is very comfortable doing so. You want to make sure that they have an impeccable reputation and they have many, many years of treating many different types of clients with Botox. That's a question that you want to ask your provider before you come in each and every time. At Avalon Laser, we've treated so many clients over the years, we've developed quite a following, but I recommend that people in each location do their homework before coming in.
Well, that's all the questions that we have today. Thank you so much for your time and sitting down and doing the interview with us.
Thank you so much. It's been my pleasure. Anytime.